Confederation, which represents organisations across the healthcare sector. Good morning, Niall.
Good morning.
We should be talking every single day about care homes, shouldn't we?
We should, and they've been neglected, frankly, for too long. And it is quite clear that there are some really difficult things going on in care homes across the country, and now we're seeing very significant numbers of patients or clients in care homes who are dying. I think the thing to remember is that unlike, a few hundred hospitals, we've got tens of thousands of care homes across the UK, so they're harder to reach in that sense. I think the second thing is that within these care homes, you've got some of them as vulnerable people. We haven't got inspectors going in at the moment. We haven't got relatives visiting at the moment. So they're very much closed institutions. And I think the staff there feel frightened and vulnerable. And we need to find better ways, frankly, of supporting those homes through this period, helping them with really quite complex things like controlling infection and so forth. There's lots of expertise in hospitals and in other NHS services, but many of these homes may not have, they certainly won't have a significant number of highly trained professional staff. Many of the staff there are low-paid carers, and they will need support and guidance to take them through this very difficult time.
And Matt Hancock promised 100,000 tests a day by the end of the month. That was bold.
Was bold. They keep saying in a very determined way that this will be achieved. And of course, in one sense, it's a meaningless figure. It's a number on a particular date. We do need to ramp up testing, but we've got to be clear why we're testing and what we're testing. And clearly, there is still a priority in our minds for testing NHS and care staff. That's very important, both of them, testing them and their relatives. Now, remember, the test is not very reliable when you don't have symptoms, which is why the relative bit is quite important. We've seen quite a rise. It's starting to fall now in hospitals. We've seen a rise in the number of staff who are self-isolating because they fear they may have the virus, but they won't know if they have the virus unless, well, first of all, they're tested, but also if their relative is tested. So if they're not showing any symptoms, testing them may not show if they've got the virus. But if you test the relative and they haven't got the virus, then the chances are, as somebody's asymptomatic, you can get them back to work. And that has started to work. And certainly we are seeing quite a significant fall in the number of staff absences. I talked to one of our chief executive members yesterday. They were up to 15% of staff were off, and that's gone down to 8%. They would normally have around 3-4% absences, so it's still above it, but it's not as great. And they're managing okay at the moment, because although there's COVID patients, they've started to plateau, and on the other side of the fence, as it were, they're still needing to ramp up all that other work, which we do need to start getting back to.
We spoke earlier on to Soumya Swaminathan, the Chief Scientific Officer from the World Health Organization. She said a number of very interesting things. She was talking about the fact that we were expecting a flu pandemic rather than a coronavirus. One of the reasons why there was perhaps a lack of preparedness in terms of PPE. We now have the situation where the long-awaited flight from Turkey, the Eagle, has landed. Will that make a difference, Neil?
No, not a huge difference. I mean, I think the original promise was for enough gowns in particular to last maybe 3, possibly 4 days. So it's an important consignment. But first of all, I think we did urge the government not to make promises about what was about to arrive. Make promises when the stuff has arrived, because frankly in that industry, the whole fashion industry, I'm told you often order stuff and the boxes aren't exactly what you wanted and they're not in the numbers you wanted. And we are seeing that actually all the way down. I spoke again to another chief executive yesterday who was saying we got a supply of aprons that were delivered, but they were all size small and they were pretty flimsy, so they tore. So it is a question of being very cautious. And there's a lack of confidence among many clinical staff on the ground. around the PPE issue and some of the guidance around that. And I think the newer guidance definitely improved that confidence. But the way you undermine confidence is promising things and not delivering them. Now, so far, it seems as if hospitals are just about managing, but it is, as people keep saying, hand to mouth on the PPE.
There aren't many people in the Nightingale hospitals. They've got a lot of capacity.
They've got physical capacity. They haven't necessarily got the staff to be able to do it. So you would need to take, and that's the issue, you'd need to take staff from other hospitals. Yeah. I think the key question there in London, and they have started to look at this, is are there ways in which you could take some staff and patients out of hospitals and put them into the Nightingale to allow those hospitals to start building up more business as usual activity. I think there'll be a question over some of the others because, frankly, we've built a huge capacity and the super surge, as it were, hasn't happened, and we really hope it won't happen. And nobody should criticise the NHS or anybody else for having created this extra capacity. No. It was the right thing to do, and great if it's not used.
Yes, absolutely. I was saying that to somebody yesterday. Because a second wave is inevitable, isn't it?
Well, I'm not an expert in terms of how this virus behaves. I think it is inevitable, as the Chief Medical Officer said yesterday, it's not going to go away. So we will have an underlying amount of virus. If we relax the social distancing, as I think is likely, it depends how it is relaxed. And the question, we certainly don't need a super surge. You may have a few more cases coming in as a result of that if you relax the lockdown. But I think it depends on how it is relaxed. And I guess one of the key points will be, how do you protect the most vulnerable going forward, even if we are able to, as I think there will be pressure to relax some of the current social distancing measures.
Although Chris Whitty said it's going to go on for a while yet, so there's some nuance, isn't it? Listen, Neil, thanks very much. There's a new normal. We're not going to be shaking hands with each other for a long time yet, are we?